A recent study suggests that our species has been getting dumber.
They say he never came close enough to Mr. Obama to pass it on. The Homeland Security Secretary was asked what her message is to worried Americans.
We can't just say stop everything.
The government now believes roughly 8 million children have come down with the virus. Among adults 18 to 64, there were an estimated 12 million cases.
Because humans have no immunity to the virus, and because there are no proven drugs or vaccines to stop it, it has the potential to cause an influenza pandemic similar to the one that killed 50 million people in 1918. It's called the H5N1 virus. Like all flu viruses, it is constantly evolving.
Realistically, is the Cambodian government and the Ministry of Health up to that kind of an operation?
At the moment, if it was to happen tomorrow, not yet.
But neither is the rest of the world. If H5N1 were to become highly contagious in humans this winter, it could spread to every country in the world in a matter of months. There is no way that governments, health organizations, and pharmaceutical manufacturers would be able to produce sufficient amounts of the strongest antiviral drugs or vaccines to contain it.
Right now, and we all admit that, right now, if we had an explosion of an H5N1, we would not be prepared for that. We would not be prepared for that. We would not be prepared for that.
There are some cool studies that have been done about surgical masks and coronavirus. They took patients who were sick with coronavirus and they just had them sit there and breathe. They weren't coughing, they weren't talking, and it turned out that they were spreading droplets and aerosols around them. They took the same patients, put on a surgical mask, and those patients did not spread the virus. But again, they weren't coughing. Another study looked at patients wearing surgical masks, but they were coughing, and it turns out that the virus was escaping the mask and still getting into the air. So this is why it's really important for us to still do physical distancing, even if people are wearing masks.
Is Canada not telling the public to wear masks because we're worried about a shortage and we want to make sure that doctors and other frontline people have them?
I think there's two separate reasons. I think for sure, absolutely, we want to protect our frontline healthcare workers. But I think the scientific evidence is that if you are sick, then put on a mask to prevent those droplets from flying, in any space as you're perhaps going to a clinic or having to move yourself around the community for essential needs. Putting a mask on an asymptomatic person is not beneficial, obviously, if you're not infected. If you're a close contact of a case and under certain circumstances, what we worry about is actually the potential negative aspects of wearing masks, where people are not protecting their eyes or other aspects of where the virus could enter your body, and that gives you a false sense of confidence. But also, it increases the touching of your face. If you think about it, if you got a mask around your face, sometimes you can't help it because you're just touching parts of your face. The other thing is the outside of the mask could be contaminated as well. So the key is hand washing, absolutely, for sure. It doesn't matter what you're doing, hand washing is really key. When you're removing a mask, in numerous infectious diseases, even in the hospital setting, we find that it's removing personal protective equipment that can actually lead to infections. So if people try to use these measures, they have to be really, really careful and wash their hands. Absolutely, that's the key. So we're also worried about the negative, potentially negative impacts.
On the ventilator question, I was just recalling SARS from covering it all those years ago. And one of the issues at that time, I mean, health officials now keep saying we've learned all the lessons of SARS. We won't repeat the mistakes. But one of the things that happened then was there was a shortage of ventilators in Ontario hospitals. Is that a situation that's been rectified in case?
Yeah, certainly we've come leaps and bounds since SARS, and we've prepared not just at the clinical level, but also at the public health level to ensure that if there is an influx of cases of this exact event, a respiratory virus, be it this new coronavirus, be it a really bad flu year, we have the capacity to manage such cases in the emergency departments, on the hospital wards, and if need be, in intensive care units.
Okay. Lastly, because we're getting a number of questions about masks, and I certainly saw people on the weekend in Toronto wearing masks around. Yeah. There are shortages of them in Vancouver and elsewhere in the country. Is it required? Is it a good practice right now to wear a mask?
So the short answer to that is no, it's not. I mean, we have probably 2 cases of this infection in Canada, and we sort of have to bring this information back down to planet Earth and just act accordingly. Like, the masks don't really protect you from getting this infection all that well, or other respiratory infections all that well. If people are infected, it prevents them from transmitting the infection, but it doesn't necessarily prevent people from getting it.
Healthy people are being warned against using face masks to protect themselves against the virus. As Justine Conway explains, experts fear incorrect use could lead to more infection.
It's becoming commonplace. On the streets and in supermarkets, people are increasingly wearing face masks, just as a precaution.
Wearing masks like that is wasting a mask. That's a mask that won't be available when it's actually needed.
The state government's advice on wearing face masks is in line with the World Health Organization. Under its guidelines, masks should only be worn if you have a cough, fever and difficulty breathing, or if you are healthy and taking care of someone with these symptoms, and or someone with a confirmed case of COVID-19.
If you do not have these symptoms, you do not have to wear masks, because there is no evidence that they protect people who are not sick.
And while they may offer some sense of security, experts warn if you wear a mask the wrong way, it could actually make you sick.
When I've been walking about, I've been seeing people touching the front of the masks, adjusting the masks on their face, and then going and touching other things. What we've got to remember is that front of the mask may be picking up different pathogens.
And the same goes for gloves.
What they also will stop is you actually washing your hands.